No doubt you remember life as a teenager, back when you took it for granted that you could really easily propel your finished explosion across the room to the roof of the car, and you may have even perfected your aim and hit targets with this stuff. Today, we focus on how to get that power back. How can you switch from a slow sludge back to a slingshot? What is the step-by-step, all-natural approach to increase ejaculation strength? So in order to help you make those moves, first I'll cover an anatomy review because it's really essential for you to understand what has to happen in order for that lock and load and the ejection to occur. Then we will unlock this mystery as to why this essential fluid even slows down in the first place. What can you do to prevent it from happening? And I want you to stop complaining because you really honestly are going to want to watch until the end because I will cover the all-natural approach to increase the volume of your explosion, improve the distance your explosion travels, and of course, give you actionable steps that you can take starting today to begin to see immediate results. So let's go. I'm Dr. Rachael Ross, board-certified physician, and this channel is all about improving men's sexual health and giving you the strategies you need to age in reverse. Subscribe and turn on the notifications so you won't miss out on this life-changing stuff. Okay, so how does ejaculation work in the first place? So ejaculate should be whitish to gray in color, thick, viscous in consistency, and it should have a slight smell, but it shouldn't stink, it shouldn't smell fishy, and it should be slightly thick and sticky. More like snot and less like skim milk, okay? Because watery semen or semen that seems too thick in consistency actually can be caused by dehydration, not getting enough electrolytes. It can happen if you're exploding too much, masturbating too much. It's watery because you're literally shooting blanks because your body hasn't had the time to recover. A poor diet, sexually transmitted infections can cause some of that, and prostate issues. All of these can lead to a very watery or even a super thick semen or no semen at all. So ejaculation occurs in 3 phases. The first phase is the emission phase. Semen enters the urethra through the ejaculatory duct, which is a pathway embedded within the prostate. The bladder neck, where the urine is, actually closes off so that urine and semen don't mix. This prevents the semen from traveling backwards up into the bladder. Then the semen is pushed further into the urethra, and then the next step is explosion. This is where semen shoots or oozes outside of the body using the force from the boval cavernosa muscles, the muscles of the pelvic floor, and perhaps most importantly, the elasticity of the prostate. So we're discussing what happens when your explosion changes from a volcano to a slow moving sludge and what can be done about that. So let's talk about what's called a structural obstruction. Think of the pathway for your ejaculate as being similar to the on-ramp of the highway. Now the on-ramp is the ejaculatory duct. Then the ejaculatory duct merges to meet the prostatic duct. Now, if the prostate is enlarged through BPH, if there is a stone present, or if there is inflammation within the prostate, consider this to be either a partial or complete road closure. It slows down on the highway, and it will also slow the ejaculate down or even stop it in its tracks. In fact, anywhere along the course of the parts of the urethra that actually travels through the prostate could slow your ejaculate down if you have an enlarged prostate. Or it could even stop it, which means an ejaculation, which means no ejaculation. So besides an enlarged prostate causing an issue, the urethra can also have what's called a urethral stricture. It's basically a kink within the tube that the ejaculate is supposed to speed through. If a stricture is present or any other form of obstruction, ejaculate will dribble or ooze instead of actually being propelled, like the slingshot. So your prostate is supposed to be the elastic band part of the slingshot. The elasticity of it is really what allows you to shoot your finish across the room or onto somebody's face or wherever you decide to go with it. This elasticity is supposed to really be present, and as the prostate gradually increases in size as you age, the elasticity is lost and collagen, which is a thick fibrous tissue, actually starts to deposit there instead of elasticity. So that ability to create that slingshot effect is replaced by more of a weak throw instead. In fact, a study looked at over 34,000 men between the ages of 50 and 80, and they had enlarged prostates. The study uncovered that 46.2 of these men, almost 50% of them, had either reduced or absent ejaculate. And so because of this, I've pinned a free gift down below that's designed to help you with that finish. So all you have to do is click the link that's pinned below. It's pinned at the top of the comments. You'll click on it, enter your email address, and I will, in a very discreet email, send you the link. Let's get back to the steps to rehabilitate this slingshot. So first, check your medicine. Your medication can be something that you can speak to your doctor about to get changed. For instance, calcium channel blockers for high blood pressure, like amlodipine, can have a variety of sexual dysfunctions related with it, and not being able to ejaculate or having slow ejaculate is part of it. Alpha blockers like doxazosin or tamsulosin, which are commonly prescribed for BPH, can also interfere with ejaculation. Antidepressants, particularly SSRIs like fluoxetines, SNRIs like Cymbalta, and certain antipsychotic medications can all lead to an ejaculation disruption. So ask your doctor for an alternative medication. That's step one. Step two, increase your water intake. Drink more water and decrease alcohol consumption, because see, alcohol actually dehydrates you rapidly. That's why you have a hangover afterwards. This will alter the consistency of your semen, which will interfere with your volume and the distance that it has the potential to travel. Next step, ask yourself, do I get enough zinc? Now, dietary zinc can be found in oysters, pumpkin seeds, cashews, eggs, meat. Now, zinc is an important part of prostate health. If you want to strengthen your finish, increase your intake of zinc. Zinc supplementation has been found to significantly increase semen volume and the semen quality. But just be careful, if you decide to take it as a daily supplement, it should be taken with a small amount of copper, or else it can wipe out your body's copper stores and your ability to absorb copper. Now, your body needs copper to make red blood cells, connective tissue, and for immune function. So be really mindful of that if you're supplementing with zinc, or if you're on a supplement with zinc, make sure there's a little bit of copper in there too, so that you don't have to worry about that. Next step, consider a prostate supplement with Pygeum africanum. Now, Pygeum africanum has been shown clinically to improve urinary symptoms and flow measured in gents with an enlarged prostate. Now, keep in mind that urine and semen all flow through the same tube-like structure, the urethra. That is one of the main reasons I formulated it to be within our Prostate Plus Flow supplement, so that we could get that extra bit of flow, urine flow, ejaculate flow, just flow. Next, begin doing dick-up exercises to strengthen the pelvic floor. Now listen, the bulbar cavernosa is wrapped around like a sling around the base of your erection, and this muscle and your erection sits on top of another intricate network of pelvic floor muscles. These muscles must contract in order to send ejaculate flying. If they're weak or deconditioned, you need to do what I call dick-ups. These are a form of Kegel exercises designed to help make your pelvic floor muscles stronger. So for more on how I suggest you do dick-ups, click on this video right here, somewhere here, and you can learn more about it there. Next step, ask your doctor about prostate massage. Now, prostate massage isn't for everyone, but it allows you to massage the tunnels where thousands of milky, thick substance has been discharged and traversed, and some of that semen may actually still be trapped there, slowing things down, creating a sludge. Toxins may have built up there over time, and it can help improve prostate circulation. Blood flow has been reduced to that area, so it isn't contracting like it should. Massage can potentially stimulate blood flow to the area as well. Now, most doctors aren't going to see the benefit of prostate massage. They'll tell you, yeah, it's not going to really do anything. But doctors used to do this in the clinic. And ask them anyway, because if you have a suspected prostate cancer, you should not under any circumstances massage your prostate. Next, stop ejaculating so much. This is last but not least, because here's something I urge you to try. Go through and do steps 1 through 7 for 3 weeks straight. For step 8, I want you to hold off on ejaculating for 2 weeks straight. Still have sex, still play around, still do what you do, but hold back. And on that 14th day, let it rip, because then I want you to come back here and comment about the flood that follows. So subscribe so you don't miss out on this groundbreaking information about men's sexual health and tips on how to age in reverse. Like this video, share it. I'm Dr. Rachel. I love you, and I will see you next week.